He had suicidal tendencies. He tried also. He attempted also. His family treats him differently. He has a separate plate. They have kept a separate glass for him. They need your support. Your support is not only financial. Your support is moral, emotional, spiritual, in all ways. Stage 1 is more than 95-98%. Stage 2 is more than 90%. Stage 4, 5-year survival, we say. Yes, it is not curable. It is stage 4. Stop tobacco first. Almost 25 to 35% of cancers are wiped out from the planet. One important thing is cancer is curable if detected early. That is what the message should go to the public.
Hi, I'm Minakshi, and I'm your moderator for today's discussion on cancer treatment and cancer awareness. I am joined by Dr. KV Krishnamani garu, DM, MD, and a senior medical oncologist at Apollo Hospital. He is going to bring his extensive experience on cancer treatment and diagnosis to us through this podcast. Hello, sir. Welcome. Thank you so much for gracing our podcast and coming here and giving us some time. I think this podcast is going to convey a lot of people what actually cancer is and create a lot of awareness. So, with that intention, let's just quickly deep dive. So my first question is what actually cancer is? Because the moment we hear about cancer, we hear this word and then we go boggling about it. Like we have this fear around this word. So we want to know what actually cancer does to our body.
So, first of all, thank you for having me. It's a pleasure to be here. And cancer, as you said, is something like a death sentence. That is what it is viewed by patients or families or anybody who hears it. So, let's understand what cancer is first. What is cancer? So, if I should talk about the medical part in a medical terminology, cancer is an uncontrolled proliferation of cells. Now, I'll break it down. Cancer is an uncontrolled, that is, there is no control. Proliferation means it's dividing of cells. So, an uncontrolled division of cells. Okay, so the cells are dividing so exponentially that it is not in your control. That is the first thing. Second, it is cancer because it has a tendency to spread. That is the hallmark of cancer. So, cancer in someone has a tendency to spread. So, now to put it in layman terms, cancer is an uncontrolled division of cells where there is a tendency to spread not only locally but also to different organs, which are your major organs like your brain, your bone, your lung, liver, etc. So that is what is cancer. But this is the broad definition of cancer, under which you have a lot of types, which I think we would discuss today.
So doctor, basically India has a different unique cancer map, right? Which is different than the cancer that is dominating Western. So what is exactly the dominating type of cancer that we are fighting right here in India?
So, first we should understand broadly what are the causes of cancer. Okay. So, why do you say India is different from the West? Why? Because see, our food habits are different, our climate is different, our environment is different, our people are different, our genetic makeup is different. So, we are not equivalent to a Japanese guy, neither are we equivalent to an American guy. So, their cancers are different, our cancers are different, our genetic makeup, our environmental factors are all different. Now, coming to the common cancers you see in our country, breast cancer is the commonest cancer you see in women in our country. Okay. Cervical cancer is a very common cancer you see in women. Earlier, cervical cancer used to be number one. Now, because of urbanization, we see a lot of breast cancer. So, breast cancer has overtaken cervical cancers in women. The cervical cancer rates in the West will be less because of vaccination.
Oh.
So the girls in the West get the HPV vaccination. So for that you have to understand that cervical cancer is caused due to a virus called human papilloma virus HPV. So now you have a vaccine. Okay, the government has also proposed that all girls between the ages of 9-15 should receive the vaccine. So in the West, most places they give the vaccine. So the cervical cancer risk is less. In India, the cervical cancer risk is on the higher side. There is a lot of consumption of tobacco, not only in the form of cigarettes, but also in the form of pan masala, zarda, kaini, and all that. So our oral cavity cancers are very high. There is a lot of smoking. So lung cancer risk is high. The lung cancers are higher in the West because the smoking incidence is higher in the West. Women who smoke are higher in the West. But India is catching up. Not in a good way though. You don't want your people to smoke, but because of the increased habits of smoking, we are seeing a lot of lung cancer in both men and women in our country. And colorectal cancer is any which way there. So what we should understand is 10% of cancers are genetic. So 7 to 10% or 5 to 10%. That is, they run in families due to hereditary factors, some genetic mutations, etc. The remaining 80 or 90%, you divide them into because of tobacco. Tobacco causes 40 to 45% of cancers in men and around close to 20-25% cancers in women. You remove tobacco, one fourth of your cancer burden will not be there. Suppose you see 5 cancers, if you remove tobacco, it will be responsible for 1 or 2 out of those 5 cancers. So you will see only 3 cancers then. So that is the impact of tobacco. So tobacco has to be removed of the list so that we reduce the number of new cancer cases we see. So to summarize for you, India differs from West because of the patterns we have, okay, because of our genetic makeup, because of our environmental factors, because of HPV vaccination not being, what do you say, uh, done for all girls and for all girls between for who deserve vaccination, high tobacco usage, smoking. Now, the Gangetic belt, which we call the areas where people reside around the Ganga, okay, the northern part of the country, there is a very high incidence of gallbladder cancer. Okay, Mizoram and the northeast, they smoke a lot. They have a very high incidence of lung cancers, oral cancers. Kashmir again has a very high incidence of tobacco related cancers. Why? Because the temperature is cold. They smoke to keep themselves warm. So in India also you have a geographical variation. You will see more gallbladder cancers in the northern part around the Gangetic belt compared to the south, and so on and so forth. So genetic factors, environmental factors, and personal factors in the form of tobacco, alcohol, and a lot of other things.
Out of pure curiosity, I just want to know, are we not yet there for the vaccinations as you spoke about Western?
Vaccination is available, the drug is available. The government has rolled out a map now that the girls will be vaccinated. So, just to give you a brief, what is this? Cervical cancer is the second most common cancer in women, highly preventable. Okay, and cervical cancer is caused by a virus, HPV virus. In that virus, there are some strains. Okay, there could be a lot of strains. The commonest strains are generally 4, 6, 11, 31, 33. So what happens is now the 4-valent vaccine we say, which contains strains of these 4 viruses, is gives you very good protection. Now there is a 9-valent vaccine. So the extra 5 variants which cause a small more number of cancers, that also is covered. So the protection for the 9-valent vaccine is even better. So 4-valent is also well and good. So boys and girls preferably, but when the government is rolling out a program, because girls are the more vulnerable group, so on a large scale, it is feasible to start with girls, and they have already started now. So the girls would be vaccinated. Girls, school-going girls from the ages of 9 to 15 preferably. If you're below 15, you generally receive 2 doses a month apart. So that gives you an excellent protection against cervical cancer. So in that way, one major cancer will be out for us. And also for cervical cancer, women must understand. Now, imagine somebody is crossed the vaccination age, somebody is married, okay, somebody is an adult. So that lady can undergo pap smear and HPV testing every 5 years or every 3 years. So with this, you are going to detect cervical cancer early if at all you have. So, on one hand, for the young girls, give the vaccine, prevent the cancer. On the other hand, do the smear, and if she has cancer, detect it early so that she is getting cured. So, cervical cancer is preventable, cervical cancer is curable, and it is caused due to an infectious agent, which is a virus, which is called the human papilloma virus.
Well, that is something we really needed to know. Thank you. So, doctor, people believe that cancer actually happens only to the older people. So, do you think that is how it is happening, or which is the demography that is getting more impacted by cancer, and how does that work?
So, understand that age is an important risk factor for cancer. So the older you live, the higher the chance of getting cancer, because over the years you have accumulated certain mutations. That is what is the theory. But doesn't mean that young people don't get cancer. You would have yourself seen in your experience, many young people would have got cancer. I had a friend of mine whom I lost, who was my MBBS classmate whom I lost to cancer. I had, we see so many patients. The last, offhand, if I have to remember, we had a 23-year-old gentleman with stage 4 stomach cancer, who was an engineer by profession. We lost him. Now, stomach cancers at stage 4 are not seen in that age, ideally. You'll
Yes.
open the textbook, it would say anybody above 60, 65. Okay. But a 23-year-old stomach cancer, stage 4, you see young kids with leukemia. Okay. Leukemia is a form of blood cancer. Those kids could be as, uh, what do you say, as young as months babies. So, cancer doesn't follow any rules. Please understand that. So, no age is immune. Yes, broadly, you will put some tick marks: older age, high risk of cancer; smoking, high risk of cancer; alcohol, high risk; tobacco, high risk; viral infections, HPV, etc., etc. But I don't have any of these. Will I not get cancer? No. So anybody can get cancer, any age you can get cancer, but yes, the risk increases with increasing age.
Okay, so one thing stuck with me. You said that even babies do get impacted with cancer, right? So is it genetic in them? Of course, because they are babies, they don't do something to deserve this, right? So how does that happen?
So yes, if you look at the, so there's a type of blood cancer called acute lymphoblastic leukemia, which is a blood cancer, which is very commonly seen in children. Okay, seen in young kids, seen in adolescents. Bone tumors are seen in young kids, especially around the knee bones, which is called osteosarcoma or Ewing sarcoma. These are all bone tumors. A lot of eye tumors are seen in kids. Then there's a special variety called the rhabdomyosarcomas. So literally, then a special variety of liver tumors are seen, hepatoblastomas we say. So pediatric oncology itself is a big field. So if childhood cancers were not so common, so I'm an adult medical oncologist. Okay. So to give you a background, I am a medical oncologist. So in oncology, there are three branches: a surgeon who will operate on cancer, a radiation person who will give radiation to cancer patients, a medical oncologist like me who gives chemotherapy or immunotherapy broadly, who gives drugs. Now, in medical oncology, you have adult oncology and you have pediatric oncology. Adult is a somebody like me with a training in treating adult people. Pediatrics is somebody who does only childhood cancers. If childhood cancers were not so common in this country or anywhere in the world, you will not have a branch. So there is a dedicated branch. There are hundreds of pediatric oncologists in the country and many more worldwide who specialize in this branch, because the incidence or the number of new patients who develop cancer in the young is very common. So there is something called cancer in kids. There is something called AYA, adolescent and young adult.
Mm.
And there, the issue is not only dealing with the cancer, also their body is undergoing a transition between childhood to adulthood, and also the mental stress and emotional things, because you always know that when a teenage you say they behave cranky.
Yeah.
Imagine a teenage guy or a girl with cancer.
Yes.
So there is a lot of things happening in their body, in their mental space and all that. So that itself is a different subspecialty. So to summarize, pediatric cancers or cancers in children are very common. As you said, nobody deserves, but most of these cancers are genetic. We do a lot of tests like molecular tests, cytogenetic tests. We identify certain mutations. Not all of them are due to familial causes. Many mutations we identify, but then it is only for academic interest. Um, you really can't. You could say that this could be the reason why the child got cancer, but there is no way of preventing it.
So, doctor, this is a question I think so many of us would like to know, that what all are the early signs that we brush off, usually thinking that, okay, let me ignore this, this is nothing. But then after that, we get to know that, oh my God, I should have gone back to the doctor, to the checkup, or I should have taken it seriously. So, what all are those signs that we usually ignore but we shouldn't have?
So you can differentiate or you can divide it into two. One is local and one is distant. Okay. Now, let's talk cancer wise. Now, for breast cancer, what would be the commonest symptom? A lady would say, I have a lump in the breast. Okay. So, any lump in the breast, simple tagline, go and show a doctor. Any suspicious lump. Okay. All lumps are not cancer. All lumps are not cancer. There is something called fibroadenoma in the breast, okay, which is a swelling. It's a regular swelling in the breast. It is not cancer. It will not turn into cancer also. But don't ignore. So if you have a suspicious lump, you find something in your breast, go and see a doctor. Fine. So lump in the breast for breast cancer. Bleeding from the nipple in breast cancer. Indrawing of the nipple, we say. The nipple goes inside. So these are all signs of breast cancer. Changes on the skin. So if you observe, there are some changes which you have seen on your skin on one side of the breast or both sides of the breast. Go consult someone. These are your local warning signs because the tumor is in the breast, right? The lump is in the breast. So it causes changes in the skin color, the way it looks, the nipple bleeding. The tumor can bleed through the nipple, or you can have a lump seeing. Number one. Number two, distant symptoms. Distant symptoms means what? You have ignored all this, or you don't know. Now, sometimes what happens is pregnant women, they can't make out a lump because of changes in the body habitus. They are unable to make out, or when they are lactating, it is difficult to make out. So many times in young women who are pregnant or lactating, they cannot detect a lump. They find it out in an advanced stage. Okay. So because the breast is engorged, it is difficult for a woman at that point in time. It's not impossible though to make. She will think that no, this is due to engorgement of my breast. She may miss that point. So what happens when you miss that? The cancer is growing, and you give it enough time to spread to other areas. Now, simple things. If your cancer spreads to the brain, what will happen? Any cancer, you're going to have severe headache. You are going to have double vision. You see everything double sometimes. All these will not be there,
Mm.
but these are some of the warning signs. It may cause paralysis on one side. It may cause seizures or fits. Okay. Now, if it goes to the bone, generally it goes to the backbones. What happens? Severe back pain. Okay. So suppose now, today, tomorrow morning, you are going to have back pain. It doesn't mean that you and me have cancer, but severe, unremitting. It is not getting better at all, and unusual. It started suddenly, okay, and unexplainable. You have done an X-ray or you have taken medication. Something is. It is not just fitting the bill. Then start thinking about it. At least go and show a doctor. Now it goes to the liver. What will happen? You'll have pain on the right side. You see more severe cases. You'll develop jaundice. It goes to the lung. You'll have breathing difficulty. You'll have cough. So a patient may say, I walk a little bit, I am feeling breathless. Now I'm sitting nowadays, I'm getting breathless. I'm unable to talk without getting breathless. I can't speak sentences. So these are all the symptoms when cancer spreads to the major organs. Those are distant symptoms. That is, distant means it has gone outside to other parts. Local symptoms is that. Now the second cancer is oral cancer, we say. What is your commonest symptom in oral cancer? An ulcer which is never healing. A man or woman may say, I have an ulcer, doctor sir, which is not healing at all. Cervical cancer, bleeding, postmenopausal bleeding, postcoital bleeding after intercourse, okay, or general PV bleeding in between their menstrual cycles also. So those are all warning signs. Now, colorectal cancer, that is intestinal cancer, bleeding in the motions. Bleeding in stool can be due to piles, can be due to fissure, but an important reason is this: alternating constipation, diarrhea. So they say, few days I'm having constipation, then continuously few days I'm having diarrhea. That is change in the bowel habit. Elderly man with anemia, any elderly person with low hemoglobin, consider colon cancer first. They may be bleeding in the motions or in the bowel. And the bleeding is not like it will be frank blood. They may not even notice. That is called occult blood. So you may not notice, you may be bleeding in the intestine. That's why your hemoglobin is falling. So, when you have an elderly man who says, I am breathless, I feel very weak, I am very tired, you check his hemoglobin, it is very low, suspect colon cancer. Okay. And sometimes colon cancer patients can come with severe pain in the tummy. Severe pain in the tummy. So, these are all the common symptoms localized. You have a bone tumor. The kids come with a swelling in the bone. They say they come with a limp. The mother says, for a few days, my son has started limping. And she will attribute it to a fall. And after this fall only my fellow developed a swelling. It's on the contrary. Because of the lymph and the swelling, he is unable to walk, he had a fall. He or she had a fall. So your symptoms are either local, like a breast lump, like nipple bleeding, or uh, bleeding through the vagina, or postcoital bleeding, or bleeding in stool. If you have a lung cancer, it could be breathlessness, cough, and not just coughing like how I'm coughing now for a second because my throat is dry. No, you're having continuous cough, not responding. You take antibiotics, you go to multiple doctors. A pneumonia which is not at all responding. What is
Mm.
a pneumonia? It's an infection. So on an X-ray, you say it's a pneumonia. It's an infection. It's a patch. Pneumonia is a patch. On this wall, there is a patch. On the same X-ray, there is a patch. So the patch, you think it's a pneumonia. You treat it with antibiotics. It's not responding. So 4-6 weeks of antibiotics. If a pneumonia is suspected, pneumonia is not improving, then it may not be a pneumonia. You're probably dealing with a cancer. The patch is due to cancer. So the and again, as I told you, when it spreads to other organs, brain, bone, lung, liver. So these are the warning signs of, so anything which has been there for a long time, not responding, unusual, and finally lot of loss of appetite and weight loss. And all gastrointestinal cancers can cause severe abdominal pain, like pancreatic cancer, stomach cancer, severe weight loss, loss of appetite. So those are warnings. And somebody tells you, "What is this? 2 months back I saw you, and now you seem to have lost a lot of weight." And then you also say, "Oh yeah, my trousers are all loose now. Something is wrong. My appetite has gone down." You attribute it to gymming, jogging, and all that, but actually it could be the contrary. So these are all things. Not these things. These symptoms are all due to many other reasons also. But watch out. Go consult someone.
Yeah, as you said, I feel like this all boils down to doing regular checkups and just taking care of yourself, be
Hmm.
aware. That's it, right? So, doctor, there's this belief, and even I am an avid believer of this, that if it doesn't hurt, it probably is nothing. That's how we operate, right? But what is it? How is it with cancer? Is it something serious if we ignore things like that? How is it with cancer?
So pain is only one of the symptoms, you see. So as I told you earlier, every symptom has to be taken with a pinch of salt. Now, just because you have pain doesn't mean you have cancer. If you don't have pain doesn't mean you don't have cancer. It depends on the location of the tumor. Now, if your tumor is sitting close to a nerve, it will be painful. Okay. Many a times infections can, if you have pus somewhere, if you have a swelling with pus, that can cause pain. It will cause throbbing pain. So you have to let down the pus. Then the pain will subside. So their pain is due to pus, which is infection. But you can have a tumor sitting close to a nerve, which can cause pain. That is not pus. That is a tumor or a cancer which is close to the nerve. So that is the way it is. So each symptom has to be verified in detail, and you have to clinically examine. So it is not a one size fits all, like saying that if you don't have pain, you don't have cancer. It is not like.
So, doctor, it is believed in families, specifically in India, that if we do biopsy, then that will impact, that will cause cancer. These kind of myths. So, what do you even have to say about this kind of thing?
So first of all, you should understand why you should do a biopsy. Okay. So how will you prove you have cancer in someone? What all do you do? So somebody comes with symptoms. They come with a lump in the breast. They come with cough or breathing difficulty. You suspect lung cancer. You suspect breast cancer. Okay. What will you do? You will do an X-ray of the lung or the breast. Then you will do a CT scan or you will do a PET scan. Fine, fair enough. Now, PET scan will say, or a CT scan will say, there's a swelling in the breast, which is 3.5 centimeter. There is also a swelling in the armpit. That means this disease has probably gone there. It also, that is the inference of a PET scan. In another patient, the PET scan may say, in the breast you have a, what do you say, a small swelling. In the liver you have 3-4 swellings. In the lung you have multiple swellings. Now, at the end of the day, it's a image, correct? How can you say it is cancer? At the end of the day, the PET scan only tells you we are seeing some swellings or some patches here and there, some spots. Size is this much. It is bright like this light, or it is not bright. We call it avidity in PET scan language. Okay, or in CT scan, they say there are some patches here and there. It will not tell you what it is. It could be TB, it could be infection, it could be cancer, it could be anything. So, to prove what it is, You have to go there, do a needle test, take a sample, see it under the microscope by the pathologist, and report it as cancer or not. So that is called a biopsy. Biopsy is a needle test where you go to a particular area of suspicion and take a few cells or take a piece of tissue and see and diagnose. So, as my teacher used to say, tissue is the issue in cancer. So, without a tissue diagnosis or a biopsy, you are not going to say someone has cancer in most cancers. In most cancers. Now, there are certain cancers where we don't do a biopsy. Like, for example, there is a disease called choriocarcinoma where it is dangerous to do a biopsy. The patient may have a lot of bleeding. So, we do certain blood tests, some tumor markers we say. On scan, if it looks like choriocarcinoma, if the tumor markers on blood, that's a blood test, is very high, then it is more or less a choriocarcinoma. We start treating. Now, somebody comes with a testicular tumor who is super sick. You are suspecting testicular tumor based on your scans. All your tumor markers are all high. Tumor markers is a blood test. You take a blood test, you look for specific parts, specific tests. They're all highly elevated. Normal is less than 7, less than 15, less than 30. They're all 3,000, 20,000, just for an example. Then you will see. And the fellow is super sick that you do a biopsy. Biopsy will take 4 to 5 days to come. Okay, you don't have time. He will die. So you have to treat him. So there, your gut feeling, your clinical experience, your acumen, you know this is a testicular tumor spread to the lungs, advanced stage, high tumor markers. Nothing is going. It is not going to be anything other than testicular tumor. So there you will say, to save the life of the patient, I can't wait for biopsy and all that. I'll going to give chemotherapy, and that fellow will respond dramatically. Okay, liver cancer. Your scan is very what do you say? The scan is very clear that it is liver cancer, primary liver cancer. Tumor marker alpha fetoprotein is very high. The patient's liver is cirrhotic. Cirrhotic means it is shrunken liver. He has a chronic history of alcoholism, viral infection, hepatitis B, C. So everything is fitting the bill. So you don't need to do a biopsy. So to summarize, tissue is the issue. In most cancers, you have to do a biopsy. In certain cancers or very sick patients, you can get away. Biopsy generally doesn't spread the tumor. Only in certain ovarian cancers and all that, we don't try to do a biopsy if it is limited, because there what will happen is if you puncture it, maybe you are upstaging the disease. So in that case, if it is a limited disease, you will directly go for a surgery. But otherwise, you have to do biopsy. Many patients come to me saying that, sir, PET scan says it is cancer. PET, now I take your photograph will tell me how you look and etc. It will not tell me your nature, whether you're a good person or a bad person. So PET tells me there is a spot here, there is a spot here. It will not tell me the nature of the spot, whether it is cancerous, whether it is infectious, whether it is tuberculosis. So PET or CT are all additional tests. They are not a substitute for a biopsy in patients where you have to do a biopsy.
Okay, so all in all, I mean, biopsy is just going to tell us what is already existing in our body, but not going to spread anything otherwise than
No?
few instances.
And biopsy gives you vital tissue to do all kinds of tests in future. Now, there is some tests called IHC, which is called immunohistochemistry. Now, in lung cancer, there are broadly 4 or 5 types. So, to find out which type it is, first you will do a biopsy. The pathologist will say it is lung cancer. Then you will do IHC to say which type, adeno, squamous, small cell, large cell, etc. Then on that biopsy itself, on the tissue, you will do molecular testing to look for mutations. So if you don't have tissue, you cannot do all that. Now in lung cancer, why do you do molecular testing? If your molecular report is positive, for example, there are certain molecular patterns we say, EGFR, epidermal growth factor. If somebody is EGFR positive stage 4, you can give them tablets. You can avoid chemo. If somebody is ALK positive, you can give them tablets. They do much better than chemo patients. How are you saying that take a tablet? You will do well only if you have the mutation. How are you finding out the mutation? On what sample? You can do it on blood, but the ideal one is tissue, tumor. How are you getting the tumor? By doing a biopsy. So biopsy not only tells me I have cancer, it also tells me the type of cancer. It also gives me molecular information. So that molecular information is a personalized information. In this room, if 5, 6 people are sitting with lung cancer, each will have a different molecular profile. One can be EGFR positive. He will be given a drug called osimertinib. One can be ALK positive. He will be given a drug called alectinib. Osimertinib will not work in him. Another guy will be ROS positive. He will be given another drug. Another guy will be all negative. He will be given chemo. Another guy will be PDL1 positive. He will get immunotherapy. So same lung cancer, same age group, 5 different people, 5 different treatments. How do you know? Only if you have tissue. So now cancer treatment is not like before. Paint everybody with chemotherapy, paint everybody with something else. No, it is very personalized in many cancers. That is why we should understand, we should inform our patients saying that biopsy is essential, not only for diagnosis but also for planning your treatment.
Interesting. As we are already talking about chemo, there's this doubt that people usually come across that what kind of cancer actually leads to hair loss, and how, at what stage or what kind of cancers actually cause hair loss, or it is that anybody who has cancer will go through hair loss. So, what's your take on that?
Cancer wise, you can get hair loss. More importantly, it is a treatment of cancer, which is chemotherapy. So basically, chemotherapy acts on all the dividing cells. So when it is killing your cancer cell, it is killing your dividing cells of the hair, your dividing cells of your tongue. That's why you have loss of taste. You have hair loss. So chemotherapy is like a bullet. It doesn't know the good guy or the bad guy. Whoever comes in between, everybody is killed. So your hemoglobin comes down because your RBC goes down, your WBC goes down, your platelet goes down. Why? They are all coming in the path of chemotherapy. So chemotherapy is like a nuclear bomb. It annihilates or it destroys everything which comes in its path. Beyond chemotherapy, you have gone to immunotherapy. You have gone to newer targeted therapy. There, they are very selective. Now, the drugs all which I told you, they are all called TKI, tyrosine kinase inhibitors. They are all tablets. They are specific. EGFR, it will target EGFR. ALK, target R. ROS, target ROS. So, chemotherapy is still used, very commonly used, but now we are slowly moving away from chemotherapy. Kidney tumors, immunotherapy is the treatment of choice. Skin tumor, melanoma, immunotherapy is the treatment of choice. Lung cancer, we could give chemos. We do give chemos, but immunotherapy and targeted therapies are there now. Colorectal cancer, we give targeted therapies along with chemotherapies and also immunotherapy. Breast cancer, we give a lot of immunotherapy. Also, chemo is still there, but you do give immunotherapy. So what you are trying to do is, rather than a broad treatment with lot of side effects, you are going to targeted treatments, minimal side effects. Again, you are personalizing treatment. Earlier, all people in this room were getting chemotherapy for breast cancer. Now you will say hormone positive, you will treat them differently. HER2 is a protein. HER2 positive breast cancer, treat them with targeted therapy. Triple negative, treat them with immunotherapy. So all these advancements have come. You're slowly shifting gears from chemotherapy to immunotherapy, targeted therapy, and individualized and personalized treatment.
So once we start losing hair, suppose it at this point we are talking that only chemo has the impact of losing hair on your body. So once that is done, are there chances that we get our hair back and we get our lives back? How it is? Because of
Yes.
course it boosts your confidence, right? So
So when my patients are distressed and when they ask us, sir, I've lost hair and all that, will I get it back before the next cycle? No, till chemos are going, generally you are not going to get your hair back. Again, there are a lot of other factors, your hair texture, each person's hair growth, what do you say, the rate is different. But by and large, most chemotherapies cause hair fall, and you're not going to get your hair back until your chemo is there. Once you stop chemotherapy, within 3 4 weeks, you're going to start getting your hair back. Now, the growth may not be as quickly as before, number one. Number two, surprisingly, you will also see a lot of young people getting gray hair post chemotherapy. Okay, they say, sir, I had nice jet black hair. I'm a young person, now I'm getting gray hair. On the contrary, you can also see some patients, elderly patients who are getting jet black hair. Okay, but broadly they will get their hair back. It will be a slow process. The hair may not be texture wise that what do you say strong, and it will take a longer time. They will say, I'm getting my hair back, but I'm still losing a lot of my hair, even when they are not on chemotherapy. That is because there will be some damage to the primary hair follicles. So, because of which, though the hair growth has started or resumed, the hair is not as strong as what it was before.
So, doctor, now with the blood cancer, usually we don't get any lumps to suspect at the earliest stage. So, what do you say? How do we suspect a blood cancer at the early stage?
So, for that, you should understand what the types of blood cancer, and how do you what are the symptoms. Now, broadly, there are two blood cancers: acute and chronic. What is acute? Something which has started recently. Okay, chronic,
Which
been
has
there for
been
a
there.
long period of time. Okay. So chronic means what it does, it gives your body time to adjust. Got it? Now acute, now it is like uh, acute means it is something sudden in your body, so you're going to have symptoms. Okay, now in that, in both acute and chronic, you have a acute myeloid, acute lymphoid, chronic myeloid, chronic lymphoid. Myeloid and lymphoid are the type of cell. That's all. So for lay people, we don't need to go there. So basically, four major types of blood cancer: acute leukemia, chronic leukemia, AML, ALL, myeloid, lymphoid, CML, CLL. Okay. Now I'll start with the chronic one. So we'll start with CLL, chronic lymphoid. Generally, how they present, I'll tell you. Elderly people, above 65, above 70, perfectly well. Okay, some aches here and there and all because of age and all that stuff. They go to do a master health checkup, or they go to do a blood test, or they're going to US to see somebody. They're getting a test and all that before going. Generally, I'm just giving you an example. They do a blood test. The WBC count is 60,000, 80,000. Normal WBC is 4,000 to 10,000. Then the lab fellow says, sir, something is wrong. We'll call and tell you. In that, lymphocytes are very high. Normally, your neutrophils will be around 50, 60. Lymphocytes are around 20, 30. There are two types of cells. Okay. So, you are normal. You are an elderly person. You go for a normal checkup, no symptoms. Your WBC is sky high. Normal is 10,000, up to 10,000. You have 60,000, 80,000, 1 lakh 50, 2 lakh 50 also. And all are lymphocytes. So, that is lymphocytic leukemia. What was your body doing when the cells have gone so high? It is not reacting. It is not reacting because it is chronic. They are growing slowly. Your body has also given space for it to grow. So your body and that have developed a mutual friendship. So you don't have symptoms generally. What do you do? Will you treat? You will diagnose first. So once you diagnose, oh, this man has chronic lymphocytic leukemia, so blood cancer, he'll die. No, he's not going to die. Nothing is going to happen. It's a blood cancer, but he is asymptomatic, no symptoms. Then there are certain criteria. Many patients you don't need to treat at all. Okay, you will not treat them at all. Why? Because they don't have the criteria to treat. The criteria to treat are they have lots of weight, you have a lot of fever, you have large lumps, a big spleen, big liver, the WBC count is doubling very quickly. Those are the symptoms, those are the hard signs for you to treat a CLL patient. So, to summarize for you, CLL is seen in elderly, mostly on routine exam, asymptomatic people. Many times you need not treat. So this is a point for you today. You thought blood cancers, matlab they will die. Here I am telling you a blood cancer which you are just picking up on routine exam in elderly people, where many times you need not even treat, but you will keep them under close follow. Tomorrow, if they are suddenly losing loss of weight, suddenly developing new lumps, the liver spleen are becoming so big, they develop other problems like anemia, W platelet going down dramatically, then you will say, boss, now your cancer is getting a bit out of hand, we will start to treat you. So they'll be under follow. Now come to the next chronic myeloid leukemia. What is that? Another cell is growing. Now, instead of a lymphoid, it is myeloid. Generally, again in the elderly, but it's seen in young people also. What are the symptoms? Very vague symptoms. They may say, I have early satiety. That is, I eat, I feel bloated. I am unable to eat a lot. They may say, this part of my tummy is full. This is the where the spleen is on the left side. So the spleen becomes very big. It comes up to the umbilicus almost. So because of that, it is pushing the stomach. That's why when the stomach is getting small, you eat a little, you feel full. If the stomach is like this, you will keep accumulating. The stomach is only this much. So little you eat, it is getting full. Why is the stomach so much? Because the spleen is pushing the stomach. Okay. So in chronic myeloid leukemia, that is the common symptom. Weakness, some fatigue. You do a blood test. Nowadays, blood test everybody does. Patients themselves go and give. Usme WBC count is sky high, 2 lakhs. There, not the lymphocytes are high. You see everybody, all the generations of cells, neutrophil, lymphocyte, eosinophil, monocyte, meta. So grandfather, great grandfather of all the cells you will see. That is called left shift, we say. So generally, you see only the mature cells in the blood. These cells also have their forefathers. All those cells you will see in the report. Myelocytes, metamyelocytes, promyelocytes. Then you will say WBC is high. It's a chronic myeloid leukemia because you have a left shift. All the older cells are also being seen. Then you will diagnose that with molecular test, bone marrow, and all that. Once you diagnose, the treatment for that is a drug tablet. It is not chemotherapy. Patients live for years together. Now, one of our patients whom we treated, my teacher treated, I have been following that lady from 2011. Now I'm still following her up. She's under my care. She was with my teacher from 98. So blood cancer, small tablet from 98. Today, where are you? 2026. So close to 28 years, 25 years, 15 years, 10 years. So why? Because that blood cancer is caused due to a what do you say, a translocation, we say. Ninth chromosome and 22nd chromosome, they interlink. So that causes a mutation because of which cells are growing. Now you found out that you are giving a drug which is breaking it. So the cells die. So the drug engineering was possible because they found this mutation. This is called the Philadelphia chromosome. Philadelphia chromosome. So that should be there. 922 we say. If 922 is there, that means you have CML. So give a drug which will block the 922. The bad cells all will die. Your WBC will come to normal. So it's a tablet. So earlier patients were not having this tablet. The tablet was not there some 30 years back or 25 years back. Patients used to be given toxic treatments. They were undergoing transplant. And once you do a transplant, the results for everybody is not great. Nowadays, transplants are rarely done in CML. So to answer your question, what are the symptoms? Chronic myeloid leukemia, I told you, chronic lymphoid may have no symptoms. Now, acute comes with symptoms. Acute means the disease comes suddenly to you. So suddenly your body is not coping up. So you have fever of 104, your body will not cope up. Same way. So what happens is all bad WBCs are there. They are called blast cells. So the blasts are coming and occupying your bone marrow. Bone marrow is your factory to produce cells. So suppose suddenly 100 guys come into your room today, you'll be suffocated for oxygen. So all the cells are bad cells. They are blast cells. The bone marrow has no space because they are occupying everything. The hemoglobin goes down, RBC cells goes down, platelets go down. So if your RBC goes down, what will happen? Hemoglobin is down. What will happen? You're finding tired, weak. You cannot walk. Okay. If your platelets go down, you start bleeding. So acute leukemias, the symptoms are bleeding. Your WBCs are all bad cells. So fever, high risk of infection. So high grade fevers. Okay. Weakness due to anemia. And you may have small lumps. Children who present with acute leukemia can present with bone pains. Many times they go to orthopedician, rheumatologist, they are treated with steroids for a very long period of time. And then after 3-4 months only, it is picked up as an acute leukemia because the blasts have gone and infiltrated the bone, causing bone pains. So these are the symptoms broadly. Okay. So chronic leukemias may not have symptoms or have vague symptoms. Acute leukemias, high grade fevers, infections, bleeding, and symptoms of anemia like weakness, fatigue, and all that. A simple blood test, a CBC, we say complete blood picture to look for hemoglobin, WBC, platelet, and in WBC, all the types of WBC cells will give you an answer mostly.
Okay. While you were answering, actually, one of the thing that was very reassuring was that I think nowadays cancer is highly treatable by medicines, which is really reassuring to us because I think in layman terms, in layman understanding, we really think that cancer is something we have to undergo surgeries, we have to undergo
Hmm.
operations and all, but that is really interesting to know.
So I'll give you an example. Today we saw a lady. I was just asking her, Dopi, how long have we been treating you? I've just asked. She was like 4.5 years, 5 years now. So stage 4 cancer, two cancer she has. She has both breast cancer and lung cancer. And for both, for the last 4.5 years, we have not given her chemotherapy. For lung cancer, she's EGFR positive. She's on a tablet called osimertinib. For breast cancer, she's hormone positive. We have put her on a tablet called anastrozole. 4.5 years, she says, my three daughters are there. 3 3 months, 4 4 months, I stay with each daughter in each place with my three different sets of grandchildren. So I'm roaming around. My quality of life is good. I'm only on tablets, no chemotherapy. Hospital visits only once in 6 months or once in 5 months. Yes, it is not curable. It is stage 4, but you are doing very well. Okay. So the bottom line is, it is not how long you live, it is how well you live. So now she has lived, in her case, she has lived for 4.5 years very well. You are popping 8 to 10 BP medicines, heart medicines, stroke medicines, that medicine. I am only giving you two cancer medicines because you have two cancers. So, with two cancers at the same time, with stage 4, elderly lady in her 60s or 70s, 4.5 years with excellent quality of life. What more do you want? So, cancer is not like what it was before. Okay, there are umpty number of examples like this, umpty number of examples. So it is like, yes, there are bad cancers also. Pancreatic cancer is very bad, gallbladder cancer advanced is very bad, stomach advanced is very bad. We have not made much progress in those cancers, but in the rest, there are a lot of changes happened, especially in lung cancer, especially in breast cancer. You had a lot of changes, especially in CML has been a wonder drug. Chronic myeloid leukemia, a simple drug called imatinib or dasatinib has made wonders. One tablet and that's it. Patients are happy.
So, doctor, there are two things that are broadly can seen as myth, but I would like you to give your take on it. That do you think people treat people who have cancer differently? They don't like to be around them. They don't like to be tagged around them, and they think that will spread. Is that true? And also, if we get to know that we have some tumor, people think instantly that, oh, it's cancer. Is that a right conclusion to jump to? So, yes.
So uh, it is very, it is not uncommon to see cancer patients being ostracized. What is ostracized? That is, they are treated like an untouchable. Okay. So I'll give you another story. We had a gentleman. He has cancer. Okay. The first few, he came to us with a diagnosis. We told him, came with his family. We told him this is cancer. He's like, no, no, Yedunna, you tell me whatever it is. You tell me. Generally, what people say, sir, my father, don't tell him anything. You please send him out. Then you tell us. So that is this one, but that happens in India very commonly. The family doesn't want him or her to know first. Sir, my mother is very weak. Don't tell her. You send her out. Then you tell us. Ideally, if you look at it from any point of view, also you have to tell the patient, because on his or her body only you're going to do everything, right? If I have cancer, you have to tell me what I'm having. You can't tell my kids or whoever it is. You tell them, but you tell me first. Okay. Anyway, so this gentleman said, "You tell me what's happening and all that." Okay, we told him, "This is it, that is it, and all that." So subsequent 2 3 sessions, he was always coming and breaking down.
Yeah.
Breaking down, not just like crying or wiping like how girls do. He's like torrentially breaking down. He's inconsolable.
Yeah.
And it'll take 10 minutes, 15 minutes for us to even start talking. And he's like, he had suicidal tendencies.
True.
He tried also, he attempted also. And why? Because his family treats him differently. He has a separate plate. They have kept a separate glass for him. Okay, his clothes are washed separately or by himself separately. uh, Many patients also complain that when they use the washroom, uh, it is cleaned multiple times by the family or whoever, the other members in the family, or they are told to clean it very to be extra hygienic and all that. Normal hygiene levels, all of us follow, right? So what happens? None of that is scientifically true. So if I use a washroom which a cancer patient is using, I'm not going to get cancer. Okay, so I tell my patients, see, I tell my the patients who have grandchildren and all of them. I said, Amma, you eat from the same plate of your grandson and feed your grandson. I also very confidently tell them, I touch all of you and I go home and I touch my son. Okay, so in that case, I would have got long back after touching you. If it spreads by touch, I should be the first guy who should be getting cancer. It is not true, but society is like that, and I think that has to change. That is because of one important thing is lack of education. Caregivers don't have the knowledge. Okay, they just hear to what people say. Somebody says something and it will fall in their ears and they treat their loved ones like that. I'm not saying everybody does, but understand that it doesn't spread by touch. It doesn't spread by eating food with the same person. It doesn't spread in the same plate. You don't need to give them a separate plate, separate washroom, separate linen bed sheets and all. That is not going to happen. It is not, doesn't spread like that. It never spreads like that. And what they require is they need your support. Okay, your support is not only financial. Your support is moral, emotional, spiritual, in all ways. So the positive side is there are so many cancer patients who are accompanied by their families, their friends, their kids, and they support them to a great extent. Great extent. I see spouses doing so much for their better halves, be it the husband or the wife suffering from cancer. I see children doing for their parents, parents doing for their kids. The list is endless. The positive stories which will come out is endless. But yes, still there is some stigma, social stigma also associated. And I think over a period of time, people should understand that it doesn't spread like that. And more than that, see, anybody can get cancer, right? It is not their fault. So rather than what do you say, ostracizing them, they should actually support them and be with them. That is what is required.
Yeah, and the second question was how is it linked with tumor? Is it
Tumor is a growth. Cancer, I told you in the beginning itself, cancer is a tendency to spread. Okay, so any tumor that spreads is cancer. That's all. Cancer has a tendency to spread and go to different organs. Tumor may just be a benign tumor. It may be a swelling and it doesn't spread at all. You have seen people with fat swellings. That's it. It's also a tumor. It's a growth of cells, but it does not spread. So it is not cancer.
so? Doctor, next question is something specific to India and specific to your experience, if I have to say. What kind of patients are more coming to you nowadays? What kind of symptoms that they are coming up to you nowadays? What kind of cancer that they are being diagnosed lately?
Breast, cervical, lung, oral or head and neck cancers, and colorectal cancers. These are the common cancers you see in India today.
That's a wide range.
Mm.
Can you just give us some reasons why they go through this?
Breast cancer purely because it's the commonest cancer. Cervical cancer, I told you, because of HPV.
Yeah.
Okay. Colorectal cancer increases as you age, you get more mutations. Oral cancer purely because of tobacco. Tobacco can cause more than 10 to 15 types of cancer, including blood cancer. Tobacco chewing can cause you head and neck cancer. It can cause foot pipe cancer, can cause stomach cancer, can cause bladder cancer, can cause leukemia, can cause pancreatic cancer. So on and so forth. Lung cancer. So that is a cause for liver cancer is caused due to alcoholism, chronic alcoholism, or hepatitis B or hepatitis C virus. There is something which is called NASH or NAFLD now, non-alcoholic fatty liver. You know, everybody is like, I have fatty liver, I have fatty liver. You do ultrasound, everybody says grade 1 fatty liver. So, sir, what is this? So, liver is basically getting damaged. One, due to alcohol. Two, due to virus. Three, non-alcoholic fatty liver. Obese patients, high cholesterols, no activity, sedentary lifestyle, binge eating. Those patients, non-alcoholic, they're not alcoholic, but their liver becomes fatty liver, and then that can go into cirrhosis. Cirrhosis is a shrunken, and that can develop liver cancer. So you see a lot of liver cancers now in NAFLD patients. So what should you do? Be slim, be trim, walk, Vegetables, fruits, 30-40 minutes of brisk walk every day, healthy lifestyle, no smoking, no drinking. So the mantra at the end of the day is all this only. And to your question, these are your 5 common cancers or 6 common cancers. And the reasons are mostly smoking, tobacco, alcohol, HPV virus, hepatitis B, C virus. 10%, as I told you, cancers are genetic. You have a family where mother has breast cancer, daughter has ovarian cancer, aunt has another breast cancer. So then you have a family where multiple people are affected and they have breast and ovarian. That is called hereditary breast ovarian cancer, HBOC. Multiple people have breast or ovarian cancers. That is due to specific mutation. For example, Angelina Jolie, if you read up, their family they have that specific mutation because of which multiple people are affected with breast and ovarian cancer.
Interesting. While we are on this topic, what is that kind of lifestyle that you would recommend to avoid any kind of cancer in our body growing cells?
Stop tobacco first. Almost 25 to 35% of cancers are wiped out from the planet. So no tobacco, no cigarettes, no tobacco chewing, no e-cigarettes. Okay, not that e-cigarettes are super safe. E-cigarettes are banned by the government. You know that Prevention of
Yes.
E-Cigarette Act or something is there, PECA
Yes.
or PESA. So no tobacco or cigarettes, no pan masala, gutka, zarda, and all that stuff. No alcohol. Okay, I always say no alcohol. Limited alcohol means it becomes unlimited, especially for our people. Finally, vaccine for your HPV for the boys and girls between 9 and 22. Cervical cancer, pap smears every 3 to 5 years with HPV testing. Do mammograms for all women above the ages of 40 or 45. Mammogram is an X-ray of the breast so that it detects the breast cancer very early. So by the time you touch and you feel, it will be bigger in size. A mammogram once every 2 years or once in a year for a woman above the age of 45, the mammogram or the X-ray will pick up a dot. The dot is much much smaller than the lump which you will feel 1 year later. So you're finding it at a super early stage and it is highly curable. So mammogram for ages above 50, you recommend a stool blood test or you do a colonoscopy to look out colorectal cancers. If you do these and then healthy lifestyle, your yoga, your walking, your gymming, your 30-minute or 40-minute brisk walk 5 days a week, they say, diet rich in fruits and vegetables, less in spice. I would always recommend more of home food, less of outside food. Drink lots of water, take lots of fluids, juices. This will be more than enough.
Beautiful. So biryani is not going to help us in the long term, is it?
Not in the long term. It'll help paradise guys in the long term, not you. So for us, for you and me, yes, once a month, that's okay for your taste buds, but it is not going to be a routine thing, not a daily affair.
So, doctor, how is the survival rate difference between a man and a woman? And if there is a gap, if it is, then why is there a gap? What's the survival rate for actually for men and women?
So survival rate is dependent on the type of cancer and stage, right? So now you talk about women, you talk about breast cancer, stage 1, it's more than 95, 98%. Stage 2 is more than 90%. Stage 4, 5-year survival, we say, in hormone positive breast cancers is extremely good, more than probably 50, 60% also. Same pancreatic cancer, stage 4, less than 5%. Now you will say pancreatic cancer is more common in men, that's why men die. Okay. Breast cancer is obviously more common in women.
Women.
Do you know that breast cancer is also seen in men?
Oh,
Okay. So if you see 10 breast cancers, one will be in a man.
okay.
Got it? So men breast cancer we treat it similarly like women only. So more than the man versus woman divide, it is the cancer versus cancer divide. You should look at survival. So the good cancers, excellent survivals, breast cancer is a very good thing. I told you testicular tumors, very good thing. Choriocarcinoma is a type of cancer in women, which is a very good thing. Now today in lung cancer stage 4, I told you some mutations are there, EGFR, ALK. Stage 4, not curable, but still those patients live beyond 3 years, 4 years, 5 years. They do well. Okay. Same pancreatic cancer, gallbladder cancer, stomach cancer, a type of liver cancer called cholangiocarcinoma. Their survivals are all less than a year or just less than 15 months. So you have good cancers, you have extremely bad cancers, and cancers in between. Colorectal stage 4, survivals are between 1 to 2 years. Stage 1, almost 100%. Stage 2, excellent survivals. They don't, both these generally don't need, first stage anyway doesn't need chemo. Second stage colorectal cancer doesn't need chemo also in most patients. Surgery alone is enough. Stage 3, the survival is more than 60 or 70%. So colorectal cancer is also a very good cancer. So now I told you, I spoke to you about blood cancers in children, ALL. Cure rates are more than 90% in children. Okay. CML, survival rates are excellent chronic myeloid leukemia. I gave you the example of our patient who's living for 28 years now. Many patients do well for 15 years, 20 years. Tablets. So they do well. They may have relapses in between. Disease may come back. You may have to change treatment in between. They may not be curable, but their survivals are excellent. And the early stages, definitely the survivals are good. One important thing is cancer is curable if detected early. That is what the message should go to the public. Cancer, I'm going to die. It's not going to be that like that. It is not that. Cancer is curable if detected early. So our aim should be to detect cancer early so that we cure cancer. Unfortunately, if it is advanced, even then in the breast and lung cancers, the survivals are very good.
So, doctor, as you said, cancer is curable if it is detected, right? So, if it is detected and we are already diagnosed, so what is the life expectancy after the diagnosis?
So you are diagnosed early, you are treated, 5 years have crossed after your treatment, you're cured. So once you're cured, what does it mean? Technically, disease is not going to come back. Very rarely, 15 years later, 12 years later, 25 years later, somebody may develop cancer. But by and large, if a patient has crossed 5 years, their cancers generally, for the early stage cancers, their cancers generally don't recur. That means they are cured. That means they have a normal life expectancy. But they are expected to be on follow up at least once a year
Mhm.
with regular checkups so that in case they have certain symptoms, you are going to pick up the disease early. So life expectancy is more or less going to be the same. The thing is going to be that your treatment in the past can have some effects, late effects in the future. So I will go into that also. Now imagine you have treated a young boy for testicular tumor when that boy was around 13 or 14 years. Now he's a young man of 28, 29. So he comes to you, he says, Dr. Saab, you treated me 15 years back. I had testicular tumor. You did a surgery and then you gave me 3 rounds of chemotherapy. 15 years now since my treatment. 15 years is above 5 years. That means you're cured. How am I? You say you're cured, boss. There is no disease. Wonderful. He says, I want to marry. I want to have kids. Go ahead. He may have infertility. Okay. Why? Because that chemotherapy at that time, I told you, chemotherapy acts on dividing cells. So your sperms could have been damaged, the ovary oocytes could have been damaged. So maybe you may be cured from your cancer, but you have late effect of your treatment. Sometimes cancer treatments can cause late cancers after 20 years, 15 years. Cancer treatments can affect your heart, especially a drug called anthracycline can cause effect on your heart. So you may have heart failure. Late. This may present late. So in your life expectancy journey, also understand that you can have late effects of cancer treatment in the form of reproductive issues, heart. You can have nerve issues in the form of tingling and numbness, okay, because of certain drugs called taxanes, especially if you're a diabetic. You can have a heart issues. So the longer you live, you may have some side effects due to the past treatment of the disease which you have been treated.
So, doctor, usually a patient comes to you with their symptoms, but the moment the disease tag comes across that you have cancer, you have a tumor, anything of that sort, of course, the patient sometimes loses their will to even fight before the treatment even starts, or before even understanding, as you already have mentioned, that there are a high probability of anyone totally battling it nicely with the cancer and breaking through out of it. But still, people do lose their will on the way, right? So how do you actually deal with those patients, and how do you give them the motivation to fight it and live through this life happily even after they have a cancer?
See, I am sitting on this side of the table. Okay, so you may think it is easy for me to tell someone because I see this daily and day out. Number one. So I understand the pain the patient is going through or the family is going through. It's a tough thing. When you say cancer itself, it hits you hard. And medical professionals who have got cancer also, when we have spoken to them, they have also felt it. They say, Arey boss, when we become a patient, we understand it is not an easy diagnosis to take. But simple thing in life is keep it simple. Okay. See, you have a problem. You would have faced so many, that is what I would think. You have faced so many problems in your life. You have given an exam, you would have failed. You would have gone and prepared super well, you have failed, you not got. Your best friends, everybody has got. So you waste a year, you sit again and prepare. So in life, you've gone all through these ups and downs. You would have been perfectly fine overnight. Suddenly, in that night, you would have had an accident. You are bedridden for 6 weeks. Your leg is in a cast. Some important events you could not attend, your exams, your sports meet. I'm just giving you multiple examples. Okay. So life is unpredictable. Bottom line is that. Now you have cancer. First of all, see whether you are in good hands. Okay. Which most people are. They are treated by good people. So you are in good hands. Be equipped with knowledge. Don't go with, as you said, myths and dogma. Dogma is people saying this, that, aisa hoga, vaisa hoga. Nahi. What is, and don't read this chat GPT and Google and what do you say, spoil your brain. Okay. So chat GPT will say, don't eat pickle. Chat GPT will say, don't add sugar. If it doesn't say, at least patients though for surely ask me, sir, I take sugar, my cancer cells will start feeding. Why? How will it feed? So the bottom line is have good information in your hand, make yourself knowledgeable about cancer, about your cancer, be aware, ask the right questions to your doctor, ensure that he or she answers your questions. Have a not only good physical health, your mentally you should be strong. Okay. I again remember this is what I tell patients when Martina Navratilova was asked. You must know her. You must be knowing her. She's a great tennis player and she's won a lot of Grand
Yes.
Slams. Okay. So when she was asked, how did you win so many tennis matches, or what is the secret of your strength and all that, she said, the strength is purely because of what I have between my two ears. That is the brain. Nothing else.
Um,
Not my hand, not my racket, not the way I play, not my speed on the court. So that space between my two ears allows me to be the greatest in the field. Okay. So it's all about your mind. So a patient who is super scared, even a young lady, will have all the side effects of treatment I will write and give you. An elderly lady who comes to you, Amma, you'll have all these side effects. Do anything you want. I have lived my life. I have seen my grandchildren also. Now I submit myself to you. You treat me well. That lady will actually have a smooth course. So, what is it? She has trusted you completely. She has faith in nature, superpower, God, whatever. She's content. Her mind is very clear, not cluttered. She is not reading Google. Okay? She's not reading. Medicine is going. I am developing rashes. What is this? Then Google will say something. It could be side effect of chemo. It could be that or this. Then that's it. BP goes up. Everything goes up. So sometimes you should keep things very simple. So you be in good hands, be equipped with knowledge, trust your family, your physician, your friends, whoever is caring for you, and I think you will do well. See, with so much of advancements in cancer and for vomiting, which used to be such a very painful thing, you have wonderful medicines now so that patients don't develop cancer related vomiting. So for those for WBC counts fall, they develop infections. We have injections now given after chemotherapy. So at every step you have a hope. So there is no reason for you to feel disheartened. And the numbers are all in front of you. Now, how we discussed breast cancer early stages highly curable, colorectal cancer early stages highly curable. Okay, so it is definitely curable. It is definitely treatable. It is in our hands. So we have to also put effort from our side. If we are sulking, if we are constantly tensed and all that, then obviously it will add to our misery.
So today's conversation was really informative. We got to know so many things that we really didn't know about, so many things that were really taboo, so many myths that we cleared today. With today's information that we have gathered from Krishnamani Garu, that the dangerous symptom of cancer is actually being silent. We think that we are okay because we feel okay right now. We think we are fine because we don't have any pain that is causing us any harm right now. We think we are okay if we don't have any lumps in us, right? But what we have to do is taking that little step and going to check ourselves regularly so that we know when we have a littlest chance of cancer. So let's do one thing. Let's take that one step, because cancer is curable when it is detected at the earlier stage. So, with that, thank you so much, sir, for giving us your time, for creating this awareness and making cancer a normal thing that we can battle actually, and also live happily with it, with some medications, with few cares that we can take. But yeah, that is something that we can fight, and we have to take care of ourselves. Thank you so much, sir.
Thank you. It's a pleasure.